Today, we are going to talk about the history of surgery, which is basically cutting people open to fix them. It sounds pretty scary, right? Well, it used to be a lot scarier. For most of human history, surgery was a last-ditch effort to save someone's life or make them feel better when nothing else worked. Why? Because surgery was super painful, risky, and often deadly. But how did we get from there to here? How did we figure out how to knock people out, keep them from getting infected, give them new blood or organs, and operate on them with tiny tools? What are the stories behind the people who made these discoveries, and how do they change medicine and the world? And what are the cool and crazy things that surgeons can do today? Join us as we dive into the awesome and awe-inspiring history of surgery. If you enjoy, be sure to subscribe. Ancient surgery. The first surgical techniques were developed to treat injuries and traumas. The earliest evidence of surgery dates back to the Neolithic period around 6500 BCE, when people drilled holes into their skulls in a procedure called trepanation. We don't know exactly why they did this, but some possible reasons are to relieve headaches, epilepsy, or mental disorders, or even to release evil spirits. Trepanation was practiced by many ancient civilizations, including the Egyptians, Greeks, Romans, and the Incas. The ancient Egyptians were especially advanced in their surgical knowledge. Medical texts that described how to treat wounds, burns, fractures, and even perform plastic surgery. One of these texts is the Edwin Smith Papyrus, which dates back to 1600 BCE and is the oldest known surgical treatise on trauma. The ancient Greeks and Romans also made significant contributions to surgery. They were influenced by the teachings of Hippocrates, who is considered the father of Western medicine. He emphasized the importance of observation and diagnosis, and laid down ethical principles for physicians. He also wrote about trepanation and other surgical procedures in his famous work, the Hippocratic Corpus. One of the most influential Greek surgeons was Galen, who lived in the 2nd century CE. He was the personal physician of several Roman emperors and wrote extensively on anatomy, physiology, pathology, and pharmacology. He performed many experiments on animals and humans to understand how the body works. He also developed surgical instruments and techniques for treating various conditions. However, Galen also made some errors and assumptions that would limit the progress of surgery for centuries. For example, he believed that the blood was produced in the liver and consumed by the body tissues. He also followed the theory of humours, which states that health depended on the balance of 4 fluids in the body: blood, phlegm, yellow bile, and black bile. Medieval surgery. These ideas influenced medieval medicine in Europe and the Middle East. Surgery was often seen as a lowly profession, and that involved cutting and bleeding people. Many surgeons were also barbers who performed tooth extractions and bloodletting. Bloodletting was a common practice based on the theory of humours. It involved draining blood from a patient to restore balance and cure diseases. However, there were also some advances in surgery during this period. In the Islamic world, many scholars translated and preserved ancient medical texts and added their own discoveries. One of them was Abul Qasis, who lived in Spain in the 10th century. He is considered one of the greatest medieval surgeons and wrote a comprehensive encyclopedia of surgery called Al-Tazrif. It covered many topics such as anatomy, anaesthesia, wound care, fractures, dislocations, amputations, and cauterization. In Europe, one of the most influential surgeons of the 16th century was Ambroise Paré, who is considered the father of modern surgery. He was a military surgeon who treated many wounded soldiers on the battlefield. He improved the treatment of gunshot wounds by using a mixture of egg yolk, oil of roses, and turpentine instead of boiling oil and cauterization. He also invented new surgical instruments and artificial limbs. However, despite these advances, surgery was still a very risky and painful procedure. There were 3 main obstacles that plagued surgery until the 19th century: bleeding, pain, and infection. Bleeding was a major cause of death during and after surgery. Surgeons had no effective way of controlling blood loss or transfusing blood. They often used tourniquets, ligatures, or cautery to stop bleeding, but these methods were not always safe or successful. Pain was another major problem. Surgery was performed without anaesthesia, which meant that patients had to endure excruciating pain while being cut open. Some patients were given alcohol, opium, or herbs to dull the pain, but these are not very effective or reliable. Some patients died of shock or fainted during surgery. Infection was a third major problem. Surgery was performed in unsanitary conditions with dirty instruments and hands. Surgeons had no idea that germs caused infections and diseases. They often reused bandages and needles without sterilizing them. They also performed surgeries that were unnecessary or harmful, such as bloodletting or removing healthy organs. Many patients died of infections or complications after surgery. These made surgery a last resort for many people. Surgeons were seen as a brutal and barbaric art that only desperate or ignorant people would undergo. Modern surgery. But this all changed in the 19th century when a series of discoveries and inventions transformed surgery from butchery to art. The first breakthrough was anaesthesia. In 1846, an American dentist named William Morton demonstrated the use of ether as an anaesthetic during public surgery at Massachusetts General Hospital. The patient felt no pain while a neck tumor was being removed. This was a revolutionary moment that ushered in the era of painless surgery. The second breakthrough was antisepsis. In 1867, a British surgeon named Joseph Lister published a paper on the use of carbolic acid as an antiseptic agent during surgery. He sprayed carbolic acid on the surgical site, instruments, and dressings to kill germs and prevent infections. He also introduced the concept of sterile gloves and gowns for surgery. His methods reduced the mortality rate from surgery dramatically. The third breakthrough was blood transfusion. In 1901, an Austrian physician named Karl Landsteiner discovered the ABO blood group system, which explained why some blood transfusions caused fatal reactions and others did not. He showed that different people had different types of blood, and only compatible types could be transfused safely. This paved the way for blood banking and transfusion services that saved many lives during surgery. These three breakthroughs made surgery safer, more effective, and more acceptable. Surgery became a scientific discipline that could treat many diseases and conditions that were previously incurable. But surgery did not stop there. It continued to evolve and innovate throughout the 20th and 21st centuries. Some of the most notable developments include the discovery of antibiotics in 1928 by Alexander Fleming, which further reduced infections and complications from surgery. The invention of the heart-lung machine in 1953 by John Gibbon, which enabled open-heart surgery by taking over the functions of the heart and lungs during surgery. The first successful organ transplant in 1954 by Joseph Murray, who transplanted a kidney from one identical twin to another. The development of minimally invasive surgery in the 1980s by Eric Moore, who performed the first removal of the gallbladder using a small camera and instruments inserted through tiny incisions in the abdomen. The introduction of robotic surgery in the 1990s by Philippe Moret used a robotic system called Da Vinci to perform complex surgeries with greater precision and dexterity than human hands ever could. The emergence of regenerative medicine in the 2000s by Anthony Atala, who used stem cells and bioengineering to create artificial organs and tissues for transplantation. These are just some of the examples of how surgery has gone from butchery to art, from a last resort to a lifesaver, from a painful ordeal to a painless procedure. Surgery is one of the most amazing and inspiring stories of human history. It shows just how far we've come in our quest to understand and heal ourselves. It also shows how much more we can achieve in the future. And that's it for this brief history of surgery. I hope you've enjoyed. If you have, I think you'd love this video on the triumph and tragedy of the race to the South Pole. I'll see you there. Goodbye.